Overcome study is one of the largest epidemiological studies. It is a web-based study, and it involves approximately 21,000 people with migraine. And the aim of Overcome study is to understand the burden of migraine, to see what are the obstacles to treatments of people with migraine, look into the stigma around the migraine, and as well as look at the migraine care while this new novel migraine therapeutics are entering the market. Interestingly, the use of opioids has been discouraged in patients with migraine, and American Academy of Neurology, American Headache Society have been recommending use of non-opioid medications for the management of both acute migraine and preventative treatment of migraine. However, despite these recommendations, the use of opioids for migraine has been high in the United States. And for this reason, we have seen in patients who have been using more opioids for migraine, increase in healthcare utilization, more disability, more comorbidities, and more disabling headaches. There is a high proportion of patients with migraine who suffer from anxiety, depression. So they already have these risk factors. And adding an opioid to their medical regimen, it is a little bit concerning. You understand the doctors who prescribe opioids to patients, they may have intentions of helping people and making their headaches better. And the patient may be asking for opioids because they would want to feel better. And they may have had previous experience with other pain and they improved and they feel that this may help their migraines. However, we do have migraine-specific treatments. We have triptans for migraine. We have, preventative treatments. We have recently approved medications who are migraine-specific. And as we showed in our study, that the number of people who are, or the large number of current opioid users are with frequent headaches. So especially in this group, you would consider preventative treatments, And one of the advantages of using preventative treatments, you decrease the number of days with headaches. So in this way, the need for acute treatments decreases as well. And if you look at the current data from these novel drugs, for instance, they have been actually assessing the use of acute medications, or days. They call it days with acute medications. So therefore, in my opinion, if there is a patient who has frequent headaches and requires the use of headache avoidant medications, the emphasis should be put on prevention, and prevention should be stressed out during the conversation.